Hi, I'm Nadia Al-Samarrie with Diabetes Health Magazine, and I'm here in San Diego at the American Association of Diabetes Educators 2016. I'm here with Annmarie Ramos from Trividia Health, formerly known as Nipro Diagnostics. Annmarie's here to tell us about the full patient line of diabetes products. Welcome to our show.
Thank you. Thank you for having me.
So you have quite an extensive line of products for patients with diabetes.
Yes, and we've grown over the years. We've been in business for well over 35 years, focusing mainly on blood glucose meters and test strips. And over the past recent years, we've grown our line tremendously, specifically focusing on some sharps that we have: syringes, pen needles, Lancets, safety Lancets, as well as a lancing device, a universal lancing device. And then we went into further products, as well as our fast-acting glucose tablet shots and gels, as well as a soft tablets that we're just launching this month. And we have a fiber supplement that's sugar-free, that's great for diabetes patients, as well as a skincare line that is very specific for different needs, whether it's a daily need, an intensive for those rough areas like your hands, elbows, or knees, excuse me, and specifically for your feet, that's great for cracked or calloused areas on your feet or your hands. And then, of course, we have our TruMetrix products. So we have TruMetrix that's been out for a couple of years, TruMetrix Air, which is our Bluetooth meter, and TruMetrix Go that we recently just received FDA approval and will be launching next month in retail stores. And what we're mostly known for is not only just the True brand of products, but specifically as also the store brand, or what we call the co-branding product. So you'll see us as the Walgreens TruMetrix product, or the Walgreens intensive cream, or the Walgreens glucose products. So I only mentioned Walgreens, but there's about 40 others.
Right, Health Mart is one of them.
Health Mart is absolutely one of them. So we have great partnerships along with CVS, Rite Aid, the list could go on. So we are available at local stores, your local pharmacies, as well as through many distributors.
That's great. So it looks like you have everything but insulin.
Yeah, well, we have insulin delivery. So yes, it's more of the products that you could get from an OTC perspective, as well as you know, a couple of prescribed, but not necessarily your pharmaceutical.
And what are the different price points, and how do they compare to other products that are in the market?
Okay, so what's great is because we don't do a lot of advertising from you know, the larger spectrum, we actually really value our partnerships with our retail partners like the Walgreens, CVS, Rite Aid that I mentioned before, that we do a lot of in-store couponing and that kind of thing with them. But the greatest idea of the whole partnership is that we keep the price as low as possible by putting the store brand name on there. So that way we can focus on the patient and what their needs are specifically, and just do everything either at the store level or through our partnerships. For instance, you'll see the TruMetrix here. We also have a free meter rebate there, and we also have some in-store couponing, as well as some copay buy-down assistance programs as well in the pharmacy levels. So there's lots of stuff there. We do a lot of couponing, including on these products too. So you'll see actual like little hang tags on them. They'll have dollars off and that kind of thing.
Oh, that's wonderful.
Yeah.
And do you have, does your meter integrate with any kind of technology?
We do. So with our TruMetrix, all of our blood glucose meter lines actually work with our PC program. It's a diabetes software that is called TruManager. And then we have the the TruMetrix Air is actually a Bluetooth meter. I can show you here. And basically it works with our TruManager Air application. It's a free app that you can actually download for free on iPhones or Androids, and here's just an example of the home page. And what's wonderful with it is that you can actually do logbook information, and you can actually scroll. It does reverse chronological, and it actually lets you look into some specific details. You could write notes, you can actually do a manual entry. What it also allows you to do is when you Bluetooth it, you can write additional edits. On the actual meters themselves, we have event tags, and there's 6 of them that you can choose from. And what we really are trying to do with the event tags, and specifically with the app and our software, is to let patients start to understand what their trends are.
Right.
So if they ate and they exercised, they can understand why they got a specific result. Mm-hmm. Or say they didn't eat but they took medication, then they can understand. So it's multiple things that could be contributing to their result.
That's great. So refining your understanding of how your blood sugars respond
Absolutely.
to your environment and what you eat.
Absolutely. And in addition to on our app, you could actually see several reports. There's averages, conformances, modal day, modal week, trends, and you can share it directly with your healthcare professional by just clicking and sharing the button. And it creates a PDF that goes directly to your email, and you send it to whomever you would like, whether it's,
that's nice.
Whether it's a caregiver or your healthcare professionals. It has lots of details and information, also on our website as well.
So the healthcare professional doesn't have to necessarily have that system. That's actually what's nice about it. So if you download it into a PDF for yourself and then you send it to them, it could be any healthcare professional, and they're happy to get the information and the data.
Absolutely, absolutely. So they can actually be well prepared ahead of time to say, I've already had this information, and share it either as soon as they get there or ahead of time, so that way the healthcare professional can prepare themselves for that appointment.
You know what's nice about the apps and doing that is that logging your blood sugars was always considered a hassle. And second to that is finding the logbook when you needed to log something.
Absolutely.
Third to that is going from memory. You know? And so before, I think when all the apps came out, I didn't really see a lot of people adopting it because it was considered, I think, a similar hassle. But now with something like that, where you have the privacy, where you can aggregate the information, where you don't have to share it with a healthcare professional. That's really, I think that's, being able to be anonymous that way allows you to be more honest with yourself. Not that you're being dishonest, but I think, as most of us, we're so busy doing things that we don't always remember what impacts our blood sugars. We really don't.
Correct.
And sometimes we're just like, we feel like we don't get it. So I think that's, I like that, because there are a lot of apps where the physicians are integrated with the apps, and I think patients, historically, when I used to have a diabetes supply store, I know weren't honest with their doctors, not because they didn't want to be, it's because they didn't want to be shamed. They didn't want to be, it's no one likes that. No one wants to be put down. Everyone's doing their best, and it may not be your best, but it's my best, right?
Yes, and it makes it a learning experience. Like I mentioned with the trends, it may be only one event that you ate, or pre or post meal, but just to see those other things that do affect your blood sugars and how that works with your lifestyle.
Right.
And that's where the main importance is for them to start really understanding, so that way they can get better control, management, and just start learning from those experiences and just take control. Take control.
Well, thank you for joining us.
No, thank you. Appreciate it.
From Diabetes Health, I'm Nadia Al-Samarrie.